Wrist injuries are actually 18 times more common in snowboarders than skiers. When you're snowboarding, you're not facing forward, which is how you normally conduct daily activities of living. You're sideways, so it's much harder to keep your balance, and part of your board usually catches the ice, which causes you to fall forward. The injury usually results from reaching out to break your fall, and you usually end up getting a fracture either in your wrist, in the larger bones of your wrist, or the smaller bones of your wrist. One, take a lesson if you're a beginner. Learning how to properly maneuver your snowboard and also how to fall properly is very key. In general, if you have to pick a side of your snowboard, it's much better to fall onto your backside than onto your front side. The best way to do that is if you feel out of control to start to lean your weight backwards, and you want to ideally round your back and tuck your arms in towards your body and try to roll onto your backside and your back instead of reaching out behind you with your hands and wrists to try to brace your fall. Number 2 would be wearing a wrist guard, and that makes sense because it prevents your wrist from extending backwards, which is where we see most often injuries to either the scaphoid, the distal radius, or other structures in the wrist. The other most important thing that I think is helpful is wearing a helmet. I think that if you're wearing a helmet, you're much less likely to reach out with your hand and wrist to protect your head, and you can better fall safely and protect your hands and wrists. The name of the game is to try to see someone as fast as possible. So if you can get in and get an x-ray, whether that's with your primary care or urgent care, then that's totally fine. Or if you have access to a specialist, I would recommend that you see an orthopedic surgeon who has some training in evaluating upper extremity injuries. An important thing is that if you don't see a specialist and you're continuing to have pain or discomfort, or if there's uncertainty about the x-ray that was taken, it is important to see someone such as an orthopedic surgeon who has more experience evaluating and looking at those x-rays.